Hi, I'm Cheyenne. I'm one of the nurses today. I'm going to be working with you, nurse practitioner students. Today we're going to be doing an abdominal exam for you. So I'm going to check the color of your skin. So if I could lift this up. So the color of the skin is pale. It's light skin color. I would say we don't see any jaundice, no discoloration. For the temperature of the skin, it is nice and warm, which is normal. The moisture, there is none. Skin is dry. Also, there is a soft, smooth texture on the skin. There is negative edema as well. Other than that, there is good turgor, negative tenting on the skin. I don't see any bruising. I don't see any scars on the right side. As far as the left side, we do have a scar in the lower right abdominal region. Other than that, I don't see any other lesions or nevi on the skin. So to do an abdominal assessment today, we're going to go ahead and inspecting for any masses, and we're going to look for the concavity or if there's a rounded belly and symmetry. So the contours of the stomach, it is flat abdomen, which is normal. We see that it's symmetric on both sides as well. I don't see any asymmetry. I don't see any visible masses in the stomach either. So next we're going to be listening to the region of the stomach and some of the arteries for any breweries. So listening with the bell of the stethoscope, we're going to listen for the aortic and the renal. Negative breweries or hums. We're also going to listen to the iliac and the femoral. So it is negative for breweries, which again is normal. So next we're going to listen to the 4 quadrants of the abdomen with the diaphragm, starting at the lower right quadrant, listening and hearing bowel sounds. The stomach is normal active, which is what we want to hear as well. So next we're going to palpate the abdomen lightly to start. Feeling for any masses, checking for any tenderness. Do you feel any tenderness or pain? Alright, now we're going to do deep palpation. Not feeling any masses. He does not have any tenderness, which is all normal again. So next we're going to go ahead and check for a few other areas of the abdomen. We're going to be checking for the midclavicular line for the liver. So we're going to palpate. Alright. And measuring out that liver. Here, put your finger right here for me. Okay. It's about 10 centimeters, which is normal. You want anywhere from 6 to 12. Next, we're going to go ahead and check some other regions of the area too. So I'm going to also check at the intercostal area for the liver, which we feel, which is normal. Yep. Checking the borders. Next, we would check the intercostal area for the spleen, which we should not feel, which I do not. Alright, and now we're going to palpate a little bit deeper using our fingers to pull back on the skin here and go underneath the intercostal area. I do not feel the spleen, which is, again, normal. You don't want to feel it unless there is enlargement of the spleen, which is not normal. Other than that, we're going to go ahead and check for pulsation at the aorta. Okay. That is positive. I don't feel any masses. Do you have any tenderness there? Very good. So again, that is all normal. So we're going to check the lymph nodes of the inguinal and the femoral arteries. Checking for any masses or tenderness. Do you feel any tenderness or pain?
No.
And the femoral going down. Alright, again, no masses, no tenderness. That is all normal. And other than that, we're going to check the quadrants for any tympany or dullness. So we're going to listen to it. Tympany. Alright, tympany, which is what we want to hear all around in the four quadrants. That is normal. Other than that, we're going to go ahead and check the interior and to the mid-clavicular line of the mid-axillary. We're going to be checking for the borders of the spleen and percussing there to see if we hear any dullness, which is called Trub's point. So checking from the interior axillary line here, you go down here, test, and down to the mid-axillary. Alright, Trub's point is negative, which again, you want to make sure you don't hear any dullness or feel any masses either. So we're going to check and perform Murphy's sign next. So any pain here can indicate gallbladder problems. So we're going to go ahead and have him take a deep breath. Deep breath. Any pain there? Negative for pain, which again, if he did have pain, it can indicate any issues with the gallbladder here. So that is negative, that is normal. So we're going to go ahead and locate McBurney's point, which is going to be a third of the way up from the hip bone, which we indicate here, to the umbilicus. So about a third of the way up is here. Any pain or tenderness there? So that is negative, that is normal. Also here, if there was any pain, we would want to further continue an evaluation in that area. So next we're going to check on any rebound pain to see if there's any peritoneal inflammation or irritation. Rapidly pull it up. Do you feel any pain? Okay, very good. Other than that, we're going to check for a few other signs to see if there's any irritations with other organs in the abdomen. So we're going to check for the psoas sign. So I'm going to go ahead and have you put your leg up, your right leg up, and I'm going to push some pressure down. Do you feel any pain?
No.
If you did feel any pain and it was in the lower right quadrant of the abdomen, that could indicate problems with his appendix. So we're going to go ahead and now test for the obturator sign, which we're going to see again if there's any irritation with the appendix. So I'm going to lift his leg up. No, flex here at your knee. Do you feel any pain? We're kind of stressing these muscles out to see if there's any pain in the lower right quadrant. Again, if he did have any pain, that could indicate problems with the appendix, which there is negative. I do want to note that this patient has had an appendectomy, so we're not going to feel any of that. But in the patient who hasn't had an appendectomy and they had stomach problems or pain, we always want to check for this to see if it could possibly be related to the appendix, as that's not uncommon or diverse. His happened when he was 16, so it can happen. Other than that, we are going to check for Ravsing sign, which we're going to put a little bit of pressure on the lower left quadrant of the abdomen, and we're going to quickly release up. Do you feel any pain? If he did feel pain, he would most likely feel if he had a inflamed appendix, he would feel pain on the right side, even though I was pressing and releasing from the left. So other than that, we're going to go ahead and perform a rectal exam. So you would lie the patient on their left side. And we're going to take a look at the area. We're going to see if there's any inflammation, redness, masses, ulcers. We're going to observe the area, which would be negative. And then we're going to tell the patient what we're going to do. We're going to perform a digital rectal exam on him, and we're going to use a glove finger that's lubricated, and we're going to go ahead and put one finger in or two, and you're going to go ahead and go towards the umbilicus. Feel for any masses, feel for any breaks in the mucosa as well. Make sure everything feels all right, nothing abnormal, no pain. This should not be painful for the patient, but they can feel a little bit of pressure. That's normal. And then since he's a man, we're also going to check for his prostate gland. So you would go ahead and turn it around and check for the prostate gland, see if there's any tenderness, masses, anything that feels abnormal. Other than that, you would ask the patient to squeeze their anal sphincter to see if there's an okay grip around your finger. If anything seems abnormal, again, you would want to further evaluate that. All right, so no pain, no tenderness, no masses found, so that's great. That's normal. That's what we want to find. So thank you so much.